All right, so this is the skin, hair, nails, head and neck, eyes, ears, mouth, throat, and sinuses. So first we're gonna look at the skin. We're gonna note any distinctive odor, which there is none present. All right, we're gonna look for any generalized color variations. We're looking for brownness, yellow, redness, pallor, cyanosis, jaundice, erythema, and vitiligo. So we're gonna go ahead and check all extremities. Everything looks good. All the texture is nice and distributed. We're gonna check legs. Everything looks good.
You can check his legs.
Hey, this is a video for school.
Yeah, Lily.
Okay, now we're looking for any skin breakdown, which I don't see any that's present. And now we're gonna look for palpate texture. We already did that. Smooth, everything looks good. Palpate temperature. Not too hot. Nice and symmetrical. Okay, now we're gonna do thickness of the skin is what we're gonna look for. So everything is nice and evenly distributed. And then on the arms as well. We're gonna palpate the mobility and turgor by pinching up skin over the sternum. So this is looking for hydration levels. We're just gonna go ahead and pinch right there. Turgor is good. Okay. Now we're gonna palpate for any edema, pressing thumbs over the feet and ankle. All that's good.
You didn't touch me. You have to do that part again.
You have your shoes on.
No way.
She's doing it now. You're good.
You're dumb. Okay, we're gonna look at the scalp and hair. We're inspecting color, which all is evenly distributed and appropriate for age. Now we're looking for thickness, texture, oiliness, lesions, and parasites. Everything is good and clean. Okay, now with the head and face, we're going to inspect head for size, shape, and configuration. Palpating at the same time. All of it is symmetrical. Now we're going to look at the neck. And then, all right, so I'm going to have you go ahead and swallow for me. We're palpating for the cricoid cartilage as well as the thymus. Go ahead.
I did already.
Swallow again.
That was
Okay.
difficult.
All of that looks good. All right. Go ahead and flex your neck all the way down. We're going to look at the cervical vertebrae now. All of that looks good and in line. All right, now we're going to do range of motion, which we already tested in the cranial nerve assessment, but go ahead and tilt your head that way. Perfect. Tilt your head this way. All good. Forward and back. Perfect. And then yes, no.
No.
Okay, you're good. All right. So now we're going to palpate the lymph nodes. We're looking for size, shape, delimitation, mobility, consistency, and tenderness. So we're going to test the pre-auricle nodes, which are right there. Those feel good and normal. Post-auricle nodes. Back there is good as well. Occipital nodes. Back there. All that feels good. Tonsillar nodes. All that feels good. Submandibular nodes. Maybe submandibular is medial border of mandible. All that is good. Okay, submental nodes. Go under there. All that's good as well. Superficial cervical nodes, superficial to the sternomastoid muscle. I'm gonna test right there.
Feel any cancer yet?
No,
We're good.
asbestos hasn't caught up to you yet. Posterior cervical nodes. Look back there. Okay. Deep cervical chain nodes, deep within the sternocleidomastoid muscle, right there. All that feels good. And then supraclavicle nodules, I'm going to test right in here. All that feels good. Eyes, we're going to look for the corneal light reflex. So I'm going to have you go ahead and look away. We're looking for perla, making sure that pupils react concentrically.
Ow.
You have to keep your eyes
You
open.
can't point it straight in my eyes. I told you this many times.
That's exactly what you have to do.
Use your phone light. It's too bright. There you go.
Equally concentrically reacting to light. Perfect. You hear that?
No.
Said you overreacted.
That's what they said at the eye doctor place.
That you overreacted?
My face was full of fluids. All I'm gonna say. My shirt was getting soaked. Yep. It was bad.
Your eyes are tearing up.
Yep. Bright lights.
Okay, we're going to inspect eyelids and lashes. Perfect. Other side.
Game in baseball has to be the hardest.
I can open my eye for you.
David. Okay, now we're going to do the external ear structures. We're going to inspect the outside, looking for any lesions or discoloration. All that looks good. And look the other way. Perfect.
Yeah, check behind the ear too. Okay.
There's no way running a marathon without hitting an MLB pitch.
Okay, now I'm going to whisper like we did with the cranial nerves test. You're just going to have to repeat what I said.
Go dogs.
All right. I don't even know what to say.
Dinner was good. I can too.
Okay, and then the last one is we're gonna look at the mouth, make sure there's no distinctive odors, which, open wide. All is good. We're gonna look inside. No redness. Go ahead and stick your tongue out, say ah. All right. All of that is good.